Good afternoon, everyone, and welcome to this afternoon's session, From Grief to Advocacy, Family Journeys to Demanding Safe Supply, Decriminalization, and Harm Reduction. I'm Kate Hardy, and I'm the Network Director of the PHI program. Thank you so much to everyone for being here in this afternoon's session. I'm so pleased to be here with Christine Wingate and Missy McLean. Christine is the director of Ontario Moms Stop the Harm. Christine lost her youngest son, Shane, to a toxic drug poisoning on March 4th, 2018. She joined Moms Stop the Harm in 2019 and tirelessly advocates for more compassionate, evidence-based drug policies. She believes people who use drugs deserve to be treated with compassion and understanding, not blame. We're also joined by Missy McLean, Director of Ontario Moms Stop the Harm. For 20 years, Missy has walked alongside a loved one living with bipolar disorder and problematic substance use. Her advocacy and activism focuses on fighting stigma and criminalization of mental illness, drug use, and poverty. She facilitates peer groups for those impacted by a loved one's substance use.
Thanks so much, Kate. And thanks to everyone who's joined us this afternoon for our presentation. I'm Missy McLean. I am nervous, and I'm going to begin by just touching on a quick overview of what we're hoping to cover in the next hour. You've already heard from Kate who we are, and which we appreciate the introduction. We're going to share our stories of grief to advocacy and why we share these stories. Talk a bit more about what we do at Moms Stop the Harm, our three pillars of advocate, educate, and support. We're going to focus a little bit more deeply on safe supply, and then we'll move on to any questions. I won't walk you through our bios anymore because Kate did a nice job of introducing us. And so thanks again for that, Kate. So to get started today, we wanted to get to know a little bit more about who's in the room with us. I can see names along the side, but just to get a sense of who's here, sort of how you were coming to today's presentation in terms of your roles and work, and then to take the temperature in the room on a few of the topics that we're going to talk about. So the voting should be activated now. If you want to go ahead and participate, put in your answers, please. And our question, had you heard of Moms Stop the Harm before? Okay, and I mean, this is not surprising for me. Moms Stop the Harm is quite established and well-known out west, and some of the work that Christine and I are embarking on is to expand the awareness and the presence of Moms Stop the Harm here in Eastern Canada, specifically in Ontario. So I think that I can end this voting at this point. Share results, stop sharing results. I'm gonna have to call on Jamie, our tech advisor, for how we advance to the next question. Here we go. Thank you, Jamie. And so if everyone can go ahead and, for those who want to participate in these questions, we're taking the temperature on your support or comfort level with a few of the issues we're going to talk about today. Okay, so some strong support around decriminalization, strong support by those who participated around safe supply, somewhat opposed, and that's to be absolutely understandable and expected, and that's why we're really excited to have this conversation today. And so our final two questions. So interesting. Thanks for everyone to everyone who participated. And we're going to return to some of these questions at the end of the presentation. So I'm going to turn it over to Christine now.
My name is Christine Wingate, and I have been directly touched by the opioid crisis. I lost my youngest son, Shane, on March 4th, 2018, at the young age of 29 to a carfentanil drug poisoning. I'm one of many mothers across Ontario that is mourning the loss of a loved one. Sadly, since Shane's death, there have been thousands of loved ones that have died. Addiction does not discriminate. It can touch any family. I've been asked often what Shane was like as a child growing up. Shane had the most beautiful smile. He had a big heart, an infectious laugh. Later on, as he grew up, he had so much compassion and kindness towards others. He was talented in art and was a naturally gifted athlete. His passion was golf and snowboarding. School was difficult for Shane. He loved to socialize, but he struggled with learning in a large classroom setting. Because of long wait periods within the school board system, we had him assessed by a private child psychologist. He was diagnosed with learning difficulties and was given special accommodations. With this, his grades immediately improved, and I noticed that he was smiling more and feeling so much better about himself. Shane was part of a loving family. Sadly, addiction does not discriminate. As Shane got older, he struggled with anxiety and depression. What I didn't realize at the time was that he self-medicated with drugs to overcome his fears. His journey with substance use lasted over 13 years. During this journey, I was his strongest advocate to help navigate the system's bureaucratic maze and long wait times to access the support that he so desperately needed. Shane went through many relapses during this time, drowning in shame and guilt and depression. But he always put his best foot forward to try and overcome his fears. Shane started off experimenting with weed in high school and then was introduced to cocaine by a classmate. I was not aware at the time that Shane was using drugs until he told me and reached out and asked for help. Again, the lack of support and long wait times did not help him with his addiction. Shane later started using pharmaceutical Oxycontin and was unable to stop on his own as the withdrawals were too severe. I reached out to the medical community and health organizations to try and navigate the system and get him the help that he needed to get off Oxycontin. I realized that Shane's use of drugs had become a coping mechanism. He self-medicated. I never once thought that a hit had become his life. He internalized so much of his pain. After waiting several long months, he was admitted as an outpatient in treatment program at the Royal Ottawa. Shane struggled with the treatment program being offered there, and after a few weeks, he left the program. A lot has changed in some treatment programs since that time, but abstinence-based treatment is not the one-size-fits-all approach. Several weeks later, we finally connected with a doctor who specialized in addiction treatment, and Shane was accepted into a methadone program. But first, he had to go through detox. As the wait times to get into a detox facility were too long, we had no choice but to detox at home. Watching my son go through withdrawal symptoms without any medical support was horrifying. I will never forget the agony and hell that my son went through. Shane was on the methadone treatment program for several years and relapsed with substance use from time to time. I realize now that he needed the wraparound support systems and services to help him with his substance use. To this day, there are so many barriers for people who use drugs to get the help and the support that they so need. In January 2018, Shane started to reduce his methadone dose gradually, and in February, all of a sudden, he decided to quit methadone. He said that he wanted to lead a normal, healthy life. He was tired of having to go to the pharmacy each day, and when he relapsed, faced the stigma associated with testing positive for opioids. After being off his methadone for over a month, I was able to see a glimpse of the boy he used to be before he started using substances. He was so proud of himself and had hope for the first time in a long time. On March 1st, 2018, Shane relapsed with fentanyl and was brought by ambulance to the Ottawa hospital. I was informed months later that Shane was unresponsive when the paramedics arrived at his apartment. He was revived after several doses of naloxone and medical intervention in the ambulance and at the hospital. Sadly, because of stigma and poor treatment by some of the medical staff in the ER. Shane walked out of the hospital shortly after that, without seeing the doctor on call. Sadly, no one reached out to him while he was there to offer any support or offer hope. Shane died 3 days later. He died alone at someone's apartment. I received a phone call by his older brother on March 4th. A large part of me died that day. Sadly, Shane lost the battle, but to his family, he was a hero trying to fight the demons of addiction to opioids. What gave Shane hope was that I never gave up on him, and he always knew that he was loved. If he relapsed, I always reassured him that it was okay, that tomorrow was a new day, to take it one day at a time. I never once judged my son and always believed in him. I was the strongest advocate to try and navigate the system's bureaucratic maze, long wait periods, and the stigma associated with using substances. As a mother, I often wondered, what could I have done differently? Since his death, I've come to realize that I did everything humanly possible to keep my son alive during his 13-year journey with substance use. The toxic drugs, the structural stigma, lack of support and services are what killed my son. We need the necessary infrastructure in place, and we need to lower the barriers for people who use substances to be able to access the necessary life-saving support and services. My son, like so many others, had dreams to fulfill and places to see. They had their whole life ahead of them. Shane's life mattered, and his legacy will live on through my advocacy with Mom Stop the Harm to bring changes to the failed war on drugs. People struggling with substance use disorder need kindness, compassion, respect, acceptance, and mainly hope. What gave Shane hope was that I never gave up on him. Collectively, we have to do better. We all need to do better. Thank you.
I'm going to share my brother's story now. And it's important for me to start by saying that everything I'm about to share with you, I share with my brother's permission, because he is alive today. The slide says Aaron's story here, but the version that I'm going to share with you here is really our story, because no version that I present will ever truly be his. So I'm here to speak not on his behalf, but on ours. And so my brother is smart, creative, hilarious, charismatic, handsome. Growing up, we were children of divorce at a time when we were the only kids in our class with divorced parents. And we survived many traumas in our childhood, but we've always had each other. And so substance use started in high school for both of us. We drank heavily, used cannabis, hash, mushrooms. We did not talk about drugs in our family. And then my brother had his first episode of mania and psychosis in the days leading up to his 19th birthday. And I think I'd heard of bipolar disorder before, but I didn't really know what it meant when the doctor started talking about a diagnosis. And it's been a challenging almost 20 years since then. He's had major episodes every 6 to 18 months, which always include interactions with the law and lengthy hospitalizations. And I've watched my brother decimate his life and then slowly put it back together again over and over. And in that time, he's been seen and treated by as many doctors as it's been years, maybe more, which I feel is significant when we're talking about impacts and connections between people's substance use and family, because in our case, the only consistency of care my brother has ever truly known is me and our mom. We've bared witness to his journey and the ways in which mental illness and chaotic substance use have impacted him. But rarely have we been treated with respect and with acknowledgement of our expertise and experience by experience, and been invited into his circle of care by professionals. It's always confused me how my brother's long history of mental illness and substance use is never easily shared by professionals, but what is always passed along are certain labels, like drug-seeking behavior. And the onset of my brother's illness brought his post-secondary studies to a screeching halt. And eventually he started working in the only industry where he felt comfortable and capable, which was bartending and serving. And that's where, that charisma and intelligence and easygoing nature and good looks really helped him thrive. And he'd get a job and he'd be so good at it. But eventually the culture within that industry would overwhelm him again. And in the earlier years after the onset of his illness, when he was struggling to manage the psychosis and mania and depression and drug use, I would drop everything to drive or fly to wherever he was to make sure that he wasn't alone. Because in the early years, that was my main concern. Make sure he's not alone. Make sure he knows that he's loved. And then things started to shift. I'm going to bring this back for a second. As he got a bit older, and it had to, when he drank even more and he used more drugs, but definitely not the ones that the doctors wanted him to take. And he hurt people, not just himself. And suddenly the patience and compassion previously shown to him by police officers, doctors, nurses, and social workers started to get very, very thin. And so soon I dropped everything to make sure the police took him to the hospital and not to jail. I can't count how many times I have had to beg, plead, and convince people, law and health professionals alike, that no, he's not just an asshole, although he very much can be when he is in the throes of his illness or his drug use. But he's actually sick. He has an illness. It doesn't show up on his scan or in an x-ray. And yes, he uses illegal drugs for many reasons. And at a certain point, I realized that I wasn't just my brother's caregiver. I also had to be his advocate. The only problem was no one showed me or him how to advocate effectively. And I always say, when it comes to people who are interacting with the systems and the family members who are walking with them, no one tells us how the system works and no one shows us how to work the system. And so when we talk about the stigma of mental illness and drug use, it can sometimes be difficult for people to conceptualize what it looks like if they've never experienced it. But it looks like losing your job over and over again. It looks, especially in the service industry, it's precarious. There are no benefits. Things are changing very slowly, but there is no appreciation or compassion when it comes to mental health in our family's experience. No one calls to ask Aaron how he's doing or to invite him back after he gets better. It's over. It looks like losing your apartment. It looks like losing your friends and most of your family because people just don't understand it and they're afraid of it. And the internalized stigma that people who use drugs live with is so painful because of course it is when the way you're trying to survive is criminalized. When you have to hide it and feel shame and are treated like less than a human. And so these days, today included, with my brother on the other side of the country and me here, I am left to sit and wait for the next call. Hospital, prison, or death. In this moment, that feels like our options. And so that is why I joined Mom Stop the Harm, and that's why I advocate. And I'm here today to speak with all of you.
Our stories are personal and unique, but they're also more common than many can appreciate. These are the photos of some of the loved ones Mom Stop the Harm members mourn. These are people from all socioeconomic, ethnic, or cultural backgrounds, and all regions are affected across our province and country. If there is one demographic that is most at risk, it is men ages 25 to 39 who use alone. Certain professions are also at higher risk, including hospitality, culinary, skilled trades, and especially people living in camps away from their families. The reasons why people use drugs vary widely, but there are some common themes, especially for those whose use becomes problematic: physical or mental pain, trauma, and a lack of hope. The majority of our loved ones who struggle and struggled with substance use also have mental health issues. According to Ontario Public Health, in 2020, there were 2,425 reported deaths. This represents an increase of almost 60% compared to 1,517 deaths in 2019. From June 2020 to May 2021, which is the most recent official data available, there's been 2,728 opioid-related deaths have been reported. This reflects the 68% increase over the previous year. From January to May 2021, 1,203 confirmed and probable opioid-related deaths have occurred.
So you've heard from Christine and I in terms of our own stories. We've set the context in terms of our loved ones and the current state of this crisis that we're all involved in one way or the other. And so when it comes to Mom Stop the Harm, many ask us, why do we share our stories? Why is that such a big part of our advocacy? And we share our stories to raise awareness and to end stigma. We engage in this work to contribute to and build upon the work, advocacy, activism, and experience of those who've been in this work much longer than us, including drug user activists and unions, other family groups, and particularly Black, Indigenous, and racialized communities who continue to be disproportionately impacted by the failed war on drugs. And our membership at MSTH is diverse, but the majority still comprises white, middle to upper class individuals. And so we recognize the privilege that exists for us regardless of our pain, grief, and experiences. And we wish to leverage this in ways that amplify the voices of people who use drugs, as well as others who are marginalized and made vulnerable by certain systems, and help to advance drug policy that helps, not harms. Sharing our stories, and primarily the stories of our founders and the story that Christine has shared today, is the power, it harnesses the power of parent advocacy. And so Mom Stop the Harm is a network of Canadian families impacted by substance use related harms and deaths. We advocate to change failed drug policies. We provide peer support to grieving families. We assist those with loved ones who use or have used. And pictured here, these are the co-founders of Mom Stop the Harm, sort of clockwise from top left. That's Petra Schultz, Lorna Thomas, Leslie McLean, and then of course, Christine and Shane in the bottom left corner. These women found each other and connected in the wake of each losing a son to a drug-related death. They formed Mom Stop the Harm in April 2016, after Lorna and Leslie returned from attending the United Nations General Assembly special sessions on drug policy. And the first meeting was held in October 2016 with 15 members. And 5 years later, I'm sad to say, or I should say it's with mixed emotion, that we are now more than 2,900 members nationwide.
Just to clarify, I am not a co-founder. I'm the director at large. Our vision at Mom Stop the Harm is that people who use drugs are not criminalized and that their rights are respected. It sees healthcare as the way to equitably provide for a safe supply of substances and diverse pathways of support for all those affected. It includes support and empowerment of families to use their voices without shame and to share their stories and to advocate for positive change.
Okay, so we've told you about who we are at Mom Stop the Harm. Now we'll tell you a little bit more about what we do. These are the three pillars that we base our work on: educate, advocate, and support. The first I'll share, education. So the education and knowledge sharing are key to our work because many members come to MSTH with their own biases and perhaps misinformed or without understanding about substance use. And so learning is a substantial part of our journey from grief to advocacy. Our education offerings include a new learning series called Holding Hope Connects. So pictured here at left is David Poses. He is a drug activist and he is holding his new memoir that tells his story of drug use and recovery. It's called The Weight of Air. We've also held events with Dr. Gabor Mate, Guy Felicella, Dr. Jennifer Charlesworth, and Jason Mercredi of Prairie Harm Reduction. And in addition to guest speakers, we've offered training to help our members feel more confident speaking to the media, community, and government. And educating and informing the general public is a priority for us too. So seen here at right is the hashtag See the Lives video series that was developed and filmed in 2018. And each participant, which included members of Mom Stop the Harm, each participant has a child whose death was attributable to or related to substance use. Each film features a parent listening to an audio of a letter they wrote to their child with a call to action to end the shame and the stigma that surrounds substance use, as well as the need to support harm reduction policies and practice. And so we'd now like to share with you from that film this section that features MSTH co-founder Petra Schultz.
Hi, sweetheart. Sorry, I haven't written for such a long time, but it hurts. In January, we would be celebrating your 30th birthday. You were 25 when we found you in your apartment with a needle by your side. Danny, there's so much I've learned since that fateful day, and so much I wished I had known in time to help you. You did not know that deadly drugs had entered the illicit market. You were one of the early victims before fentanyl made the news and before there were any health warnings. Imagine if we had a poisoned water supply and more people were dying. Would we allow for this to happen, or would we fix the problem? We did not understand how treatment should look like, the risk of relapse, and how to keep you safe. I wish I had known about harm reduction, about keeping people as healthy as possible without judgment or shame, about the medication naloxone that can reverse an overdose. Thousands of lives have been saved, and now I carry a kit in my purse wherever I go. I do know you would be proud of me and the advocacy work I do with other affected moms and families in our group Mom Stop the Harm. Sweetheart, you're donating your story. I'm your voice, and I get to speak your name. Take care, sweet. Love you forever and always, until I find the strength to write again. Petra?
So the second pillar that I'll speak to now is support. And I actually often think of support as being the foundation of all the work that we do at Mom Stop the Harm, because so many of the members come to the organization in their grief looking to connect with others, looking for support. And often it's the support piece that then allows people to move into a place of being able to do the advocacy work if they choose. This image shown here is the cover of Gone Too Soon. It's a handbook that was created by MSTH co-founders Leslie McLean and Petra Schultz, MSTH board member Angela Welts, and member Karen Bell, in partnership with the BCCSU, BC Bereavement Helpline, the Affected Persons Liaison, with the BC Coroners Off and Service. And we're in the midst of creating specific versions of this book for each province and territory because they're so desperately needed, and they're available on our website. We also have online support for people in the form of Facebook groups. We have our public profile, but then we also have closed groups, private groups, where people can connect with one another. Healing Hearts is a grief support group for those who are grieving the loss of a loved one to a drug-related death. Holding Hope is for families of loved ones with lived or living experience. And there's also a sibling group. Recently, especially in the last year, we've worked really hard to expand the support piece of what Mom Stop the Harm has to offer to our communities. This is being done under the banner of Stronger Together Canada, and it It's intended to build capacity and improve outcomes for individuals and families using a peer-led support group. Healing Hearts, again, families who have lost loved ones, they provide bereavement circles, and Holding Hope is for families whose loved ones are currently still using. This expansion of the peer support programs is being funded by a grant through the Health Canada Substance Use and Addictions Program. And really, Stronger Together comprises these two streams with Holding Hope and providing a safe gathering space for family members who are impacted by a loved one's substance use. Healing Hearts offering that traumatic bereavement circle for those who have lost someone. And both use a peer support model and are entirely volunteer facilitator-led. Facilitators must be MSTH members, but members of the groups do not need to join MSTH in order to access support. And the Stronger Together project launched in March 2021 because we can't do this alone. We now have dedicated sites for each of these support groups. I'm showing on the slide the current groups available in Ontario, and we have facilitators who are undergoing training right now. And the objectives for this project of Stronger Together Canada is really to build family capacity across the country through 4 key components, which is to engagement of families with lived experience who are interested in starting a support group in their community. We're training and providing training and ongoing development and support of family members who step forward to become facilitators for Healing Hearts or Holding Hope. We're developing a library of resources and toolkits to ensure the success of facilitators across all communities. And we're developing an evidence base on the impact of grief on Canadian families. So each group is led by a volunteer facilitator who has experienced a substance use-related harm or loss. And peer facilitators are trained and supported by the Stronger Together project team, which means we're not left, once you become a facilitator, and I am a facilitator currently for Holding Hope and soon to be starting a Healing Hearts group in my community here in Northumberland County, that we are also supporting facilitators so that they're not left alone. We provide debrief and ongoing support for the facilitators, recognizing that they are taking on significant emotional work in facilitating these groups. And the groups are open to all families with lived living experience in the region where they are offered. The project also prioritizes outreach and capacity building in Indigenous communities with an emphasis on cultural safety, again, to strengthen families' ability to navigate complex health systems and supporting their loved ones and in dealing with their grief. Training is happening right now for members who are ready to start a group in their community, and more will be added soon to the list that you see here. The third pillar of our work at Mom Stop the Harm is advocacy. This is what brings us to the PHI Conference this year. So grief drew our founding members together, and through their mutual support, they channeled their grief into advocacy. At Mom Stop the Harm, we advocate for the following: what you see on your screens: a safer regulated supply, decriminalization of people who use drugs, barrier-free harm reduction in all provinces, evidence-based treatment that includes a variety of options, upstream prevention and interventions, meaningful inclusion of people with lived and living experience and their families in all decisions that affect us. Nothing about us without us. And here we share some of the ways in which we engage in our advocacy. We use a variety of strategies and tactics, meeting with political leaders, including earlier this year, Christine and I had the opportunity to meet with Associate Minister of Mental Health and Addictions, Michael Thibodeau. Members across the country attend and participate in conferences such as PHI to connect with the professionals and other advocates and activists who are in this work. We participate in media stories, webinars. We have active social media accounts, participating in anti-stigma and anti-discrimination campaigns. Christine sits on a number of groups and committees. We also engage in rallies, marches, protests, and research projects, one of which I'm going to share with you now, just very briefly. I'd encourage you to seek out this article that's been published in the journal recently. So participating in research is another way in which we advocate, and we'd like to direct everyone to this recent academic article sharing the results of the past 5 years of qualitative research examining the experiences of grieving mothers as advocates, which is co-authored by founding MSTH member Petra Schultz. What did the findings show? They showed that participants' motivations for engaging in advocacy were rooted in their experiences of grief, and that advocacy led to feelings of empowerment and connection to others. The research also suggests that advocacy can be cathartic and associated with healing from grief, which certainly aligns with our experiences, but that going public and sharing a family story of substance use death can also have a considerable personal cost.
What we did is we reached out through Twitter and through our social media. We wanted to send a letter to all party leaders and ask them what their position was on our key items that we advocate for. So our positions for decrim is that people who possess now illegal substances for personal use is a government policy stance that directly contributes to people using and dying alone. It prevents people who feel that they want help with problematic drug use from seeking it and perpetuates deadly stigma. We also asked them their view on safe supply, because thousands of people are dying from toxic drug poisons, and more so than ever before, particularly since measures to prevent the spread of COVID have isolated people from services and support. This pandemic has also disrupted supply routes of illegal substances, resulting in a more concentrated and contaminated supply. Harm reduction is grounded in a comprehensive scientific, trauma-informed and human rights-based approach. The evidence is clear that harm reduction programs such as safe consumption sites, drug checking, overdose prevention, and reversal services all work to prevent deaths and connect people who use substances to public health and social programs. These approaches are cost-effective and have a positive impact on individual and community health. Legal regulation. Alcohol, tobacco, cannabis are currently legally regulated in Canada, using controls to manage the vendor, the supply, and the outlet, the product, and the purchaser as appropriate. Drug regulation with a public health focus could provide safer access while protecting individuals and populations. The catastrophic death rates we are currently seeing tell us that prohibition, as was the case with alcohol prohibition, adds to rather than prevents harms. We support a range of evidence-based treatment options that best meet the needs and desires of each individual. It is complex, and everyone deserves pathway to wellness and what their treatment should be tailored to what they request. Some of the ongoing initiatives, the other advocacy examples that we do, since last September, there was a variety of Mom Stop the Harm members who participated in a paper petition campaign. While paper petitions may seem old school, they have more strength than parliamentary online petitions. Specifically in the petition, we asked the federal government of Canada to declare the overdose crisis a national public health emergency and immediately collaborate with provinces and territories to develop a comprehensive pan-Canadian overdose action plan. We also ensure that any plan considers reforms that other countries have used, such as legal regulation of drugs, to ensure safe supply, decriminalization for personal use, and changes to the flawed drug policies and policing. We need to ensure that this emergency is taken seriously with adequately funded programs and supports. In November of 2020, Mom Stop the Harm also reached out to municipalities and Indigenous communities across the country for their assistance in ending the overdose crisis and the toll it is taking on our communities. Specifically, we asked them to consider passing a resolution on the overdose crisis, calling the Government of Canada to do the same as what we shared in the petition. To date, there's 42 municipalities have adopted the MSTH resolution in full. 15 municipalities have passed part of the resolution, and 5 municipalities have passed their own resolution. We are continuing with both the petitions and the municipal resolution as the new government is now in power.
Okay, so in addition to all of these, I would say standard or common forms of advocacy, Mom Stop the Harm has recently started to engage in more radical actions. In the interest of time, I'm going to just really briefly touch on 2 lawsuits that were currently initiated and then focus on an activity that took place on International Overdose Awareness Day this year in BC. So 2 lawsuits that I would encourage everyone to explore in more detail are underway, in which MSTH members are named as lead plaintiffs. They frame issues of decriminalization and access to supervised consumption sites within a human rights context, and in addition to a health context. And they're directed at governments who hold responsibility for the failed and harmful drug policies that deny people services and care. So one of our members is working with others from the Canadian Association of People Who Use Drugs to take the Government of Canada to court to seek decriminalization of drug possession and necessary drug trafficking. And another member is challenging Alberta's restrictions to supervised consumption sites in their province. So we're deepening our partnerships with drug user unions and activists and taking bolder action to match our demands. And I'm going to share with you a quick example of one of those more radical actions as well. So on August 31st, IOAD of this year in BC, MSTH members joined the Drug User Liberation Front, or DULF, and VANDU, the Vancouver Area Network of Drug Users, to hand out 14-gram samples of tested safe supply heroin, cocaine, and methamphetamine to pre-registered people who use drugs. So pictured here, among those pictured here is MSTH board member Deb Bailey and advocate Lizzie O'Sullivan. MSTH supports a compassion club model, which is being proposed by many of the drug activists and drug user unions as one of the many possible avenues that can get safe supply into the hands of those who need it. The compassion club model, for those who aren't familiar with it, as defined and endorsed as well by the British Columbia Centre on Substance Use, is a cooperative model to reduce opioid overdose deaths and disrupt organized crime's role in fentanyl, money laundering, and even housing unaffordability. This model is inspired by the cannabis compassion clubs and buyers clubs, both of which emerged in the 1980s and 1990s in response to the AIDS epidemic. And at that time, compassion clubs functioned, and still to today, to provide a safe place for people to access the medicines and connect with a range of health services, while buyers clubs procured life-saving treatment for patients living with, when government inaction limited access to those medicines. And so, again, we need different options for different people. And most of all, we need people to stop dying. And here I'll just say that, we are stronger when we work together when it comes to advancing better policies and the rights of people who use drugs. On the right is a list of the wins people who use drugs and their allies have achieved through their work to date. Just some of the wins. And as Garth Mullins, I don't know if anyone listens to the Crackdown podcast, but as Garth often reminds us, every gain made by people who use drugs to save their own lives and advance their liberation was won with acts of resistance they've courageously led. And this is why Mom Stop the Harm advocates recognize and honor that our part in this work is to stand alongside or behind, but never in front of people who use drugs. We listen and take our directives from their leadership and guidance, because they are the experts in what they need.
The people most affected and experts in drug policy call for action in these 5 key domains. The ongoing deaths in our communities demonstrate that the current responses to the overdose crisis are insufficient, as they fail to address the structural causes such as poverty, criminalization, lack of access to a safe supply of drugs. Substance use needs to be treated as a health issue and not a criminal one. A safe, regulated pharmaceutical drug supply should be available for those who use substance or have a current substance use disorder, and when and if they are ready, streamline pathways to treatment. I would prefer to have Shane use safely over grieving him. As long as the person is alive and healthy, there's always hope. The truth is that people who use drugs, people like my Shane and Missy's brother Aaron, are like you and me, and they deserve a chance to stay healthy and to have a future. Shane didn't have that chance. He's on our mind every day, and we miss him terribly. He always said that I gave him hope, and I am so forever grateful for walking by his side through his journey with substance use. I wonder how different the outcome could have been if he had had access to a safe supply and more streamed pathways to wellness. Thank you.
So at the beginning of our presentation, we took the temperature of the virtual room here to get an idea of how people feel about some of the key advocacy issues we address. And so we thought maybe as a gentle entry into a very short, probably Q&A part of this presentation, that we'd like to hear from you again. So if we can bring up this final poll question, and we'll just quickly, for those who'd like to participate, see how we're feeling now. Thanks to everyone who participated in this poll. I'm actually heartened by the responses, and I appreciate everyone participating. And so now we only have a couple of minutes, but if there are any questions, Christine and I are open to them.
I'll just say thank you so much, Christine and Missy, for sharing with us this afternoon, and certainly for this very impactful presentation. But why don't I let you address this one that just came in, Missy?
Yeah, can peer support organizations help by uniting more with you? There are peer support initiatives who would want to very much. I mean, I would say my first, reaction is yes. There is peer support is invaluable, and at this time where there really is such a need, especially for grief support for people who are losing loved ones, that the more we can unite and help connect those who need access to support, the better. So absolutely. And, we can be reached on the website, we can be reached on social media. I'd be happy to have conversations about how peer support groups can work together. It's really about, there is a gap that exists right now in this country in terms of providing people with the support that they need. And so those of us who have lived experience have a lot to offer, and that can help to fill that gap, is our hope.
Okay, well, thank you once again to our presenters for taking the time to share, and thank you for our attendees for being here.
Yeah.
We do have a 15-minute break, and then we'll see you all in the next session.
Thank you to everyone for coming.
Yeah, thank you. Thanks, Kate. And thanks, Jamie, for the tech support.